Hello, my name is Victoria Hynes, and I am the Program Manager for the Training and Education team at the Maine Health Center for Tobacco Independence.
My name is Giles, and I am the Program Manager for the Maine Quit Link, formerly known as the Maine Tobacco Helpline. It is our pleasure to share a little about our poster and briefly explain how our programs have pivoted into the digital space, why we have chosen to do so, and share with you some of our learnings and preliminary observations. Victoria and I work for the Maine Health Center for Tobacco Independence, or CTI, which works across the state of Maine to address tobacco use and exposure through education, prevention, policy, treatment, and training initiatives. CTI receives funding from a variety of sources, including grants and from Maine Health. As a component of these efforts, CTI administers statewide tobacco treatment and prevention contracts on behalf of the Maine CDC and Maine VHHS. The map and chart on this slide demonstrates that 17% of Mainers use tobacco, and these individuals are more concentrated in rural areas, and as education level and income level decreases, smoking rates increase. If any of you have questions about the data on this slide, please reach out to us via email or phone, or join us at the poster session Q&A on 10/7. So do online tobacco treatment services increase reach and reduce barriers to engagement in treatment? So a few years ago, the Maine Quit Link, along with other quit lines nationally, asked this question. And for those of you that don't know, the Maine Quit Link offers free and confidential treatment to tobacco users as well as those who vape statewide. We've been around for 20 years, and many folks are familiar with our long-standing evidence-based phone coaching service that also provides over-the-counter NRT at no cost. Despite positive outcomes over the years, we've struggled to reach priority populations such as pregnant women, LGBTQ+, and low SES, and the age range of our participants has been highly skewed to the 50+ group. We knew we needed to improve our reach, and we also saw a need to provide more flexibility, choice, and fewer barriers for people when it comes to accessing our services. So we launched some new digital services. Web Coach, which is an online coaching program with a 2-week NRT starter kit, and individual services, which are 4 standalone services that can be combined in any way. They are text materials, emails, and a 2-week NRT starter kit. The goal with these programs was to provide a simpler option that provides more choice and flexibility. We also added an online website as optional support for folks in our phone coaching program, and the ability to enroll online for any of our services, including phone coaching, which allows for more privacy at intake and also is just more convenient for many. So back to that question, do online tobacco treatment services increase reach and reduce barriers to engagement and treatment? And the preliminary data says yes, absolutely. There's a lot of potential here. Web Coach has consistently contributed to 10% of all enrollments, but individual services, which launched just this past winter, has contributed to 30% of all enrollments in our program. We're seeing more diversity in those who use these programs, and the number of pregnant women and individuals with Maine Care who have registered for these services has increased. LGBTQ+ users have stayed the same, but these folks are choosing the online options over phone coaching. We're encouraged by what we're seeing, and I'm going to turn this back over to Victoria to tell a little bit about what she's been doing with her program.
Hello again. Today I'm going to share with you some information about our training team and pivot to remote work as we seek to answer the question, do virtual trainings increase access to evidence-based tobacco treatment training and enhance health professionals' comfort and skills in treating tobacco use disorder and or referring to treatment? So let's start with a little bit about us. CTI's Training and Education program delivers training on evidence-based treatment across the state, improving access to high quality best practice tobacco treatment. Multiple training opportunities are offered throughout the year to support health professionals. While the science behind nicotine addiction is clear, health professionals are often unaware of the evidence-based treatments, unsure of how to start the conversation with patients, and unaware of the resources available to them, which is where training and education plays a vital role. So how might virtual trainings increase access to evidence-based tobacco treatment training? First, let's touch briefly on the landscape of our program prior to COVID-19. At that point, we were providing a range of in-person trainings across the state, traveling to pretty much every county in the state to deliver trainings. While we had started to dip our toes into the water of virtual offerings pre-pandemic, we had not yet developed live virtual training offerings, and we often received participant feedback that travel, time out of the office, and location of our trainings was a barrier to attendance. So the pandemic really forced our program to think about how we offer trainings and then shift to deliver them differently. In FY20, we held 3 virtual trainings of 4 hours of content or longer, including our annual tobacco treatment and prevention conference. While we are still learning the ways virtual trainings impact access to evidence-based tobacco treatment, the initial results from our post-training evaluations are overwhelmingly positive. We saw a significant increase in the number of participants at trainings, and we had participants from all over the state. The graphs and the narrative from our surveys, which you can see on the poster here, support this. We've learned a lot about the design and implementation of virtual trainings that we have outlined here. For the sake of time, I'm not going to read each one, but I do encourage you to look through them and think about questions that you may have. And I'll be happy to answer those questions at the live Q&A in October. At this point, I'm going to turn it back to my colleague, Amy, to wrap up our session.
Thanks, Victoria. So as far as the main quit link, we are learning that people really just want to quit their own way. And for some people, that's phone coaching, but for others, that's digital services. Some simpler, some more involved. And as far as next steps, we'll be focused on monitoring and more monitoring of our utilization and demographics data to help us understand what we can do to further move the needle and reach all populations. We've launched and will continue to roll out targeted campaigns, some digital, that are directed at specific populations, and we're also in the midst of our latest outcome survey, which will help us understand the participant experience better. As a final thought, based on what we're seeing, we believe offering innovative, low barrier and accessible online choices can lead to a positive outcome and potentially increase the population health impact of the main quit link. We'll be excited to give you an update and share more around how things are going this spring, probably through a webinar. Thank you so much for checking out our poster. Again, we'll be at the poster Q&A on October 7th. And if you have any questions, you can email or contact us. Our contact information is on this last slide. Thanks so much.